My doctor left in October of 2019. I remember 811 calling me one day and I thought, oh gosh, here we go, we're gonna have a doctor. And they said, no, we're just making sure you still need one and letting you know you're still on the list. So it doesn't look good at all.
There were tens of thousands of patients in Nova Scotia who didn't have a family physician. People needed care. And especially given that there wasn't a lot of places for people to go to be seen.
For prescription renewals, I would either go into the Yarmouth outpatients where there you know you're looking at 6 to 7 hours, if not more. If not, I would go into Shelburne. I could drive there and back in less time than it would take me at outpatients in Yarmouth.
Quite often I hear, I'm thankful I don't have to sit in the emergency department for 12 hours to get my cholesterol medication refilled, which is what a lot of people have been saying that they've had to do.
I had registered as not having a doctor with 811, but then this came up and I said, well, I'm going to try it, and I started using it from there on in.
For a lot of patient needs, medication refills, rashes, mental health issues as well, a lot of those can be dealt with virtually.
It was very easy to use. I've used 3 different forms of communication. So we had one doctor just text me back and forth, one doctor phoned me, one doctor called me and did video conference. So they're all very easy and it all went through the app and worked with no problem.
So patients would submit a request to talk to a doctor. They would submit their sort of presenting complaint and what they were expecting, and they would be rather randomly assigned to a physician who would be on the platform at the time, and the connection would be made, and then introductions would be done, and then you start talking about what the issue is.
All the doctors have been more than inviting and kind, and they seem to take their time with you and everything. It's not a big rush or anything.
Ordering investigations and tests, referring to specialists, all that is available to patients who are on Virtual Care Nova Scotia. So it's essentially like a family medicine office without the physical exam.
I don't have to go sit amongst people that are sick, right? If I'm trying to get a prescription, I don't have to leave my house. I can sit here and do it. Like it's awesome.
We have the ability to, if we need to, arrange for people to be seen in person at one of the primary care clinics within Nova Scotia.
I had a problem with my leg and I said, I'm going to give it a shot. And through the Maple app, she sent me requisition for an x-ray, requisition for blood work. I also needed prescription renewal at that time. And then she wanted follow-up, and I was sent to the primary care center at the bottom of the Yarmouth Hospital, which I didn't even know existed.
I think that it's shown that it can work, that it is efficient, that it's effective, and that people like it, patients like it. I think physicians like it as well because they can add it to their practice mix. I hope that it stays.
This is a great system. Honestly, I love it.